Hello, good evening, Sunday, 8 p.m. Dr. Rob Kiltz, how you doing? The Fertile Fireside Chat, still off. Warm summer, August. Boy, it seems to be getting closer and closer to fall. And welcome everyone and gratitude to all. And always a pleasure to be here sharing, talking, ideas for fertility. Jessica, how you doing? Natalie, a pleasure. We got some watchers, some commenters. Vanna, a pleasure. And here going to share some more thoughts and ideas on how to make your fertility journey better. Bonnie, Megan, hello, hello, hello. And just waiting to get it going online here. And hang on, I got to take it out airplane mode in order for me to connect. And coming. And there we go. And here to share some thoughts and ideas how to make, again, this more successful journey. Very, very stressful, as we all know. We're hoping that the Fertile Fireside Chat gives you some ideas of increasing success, whether you come to see my fertility or not. We're seeing clients from all around the country and the world. And again, our job is to make it affordable, accessible, but always high quality. And we've really learned so much as we delved into the power of the mind and what you put in the mouth, both of those, by the way, faith, and don't forget keto. And a lot of this is some labels. A lot of it is how to help us find the right way. And whether you're calling from Erica from Arkansas, Janet, how you doing? I had a great Thursday, Friday, Saturday, and traveled today, Sunday. I took a few calls today and a few texts. But I'm back. It was really great. I was down in Sarasota. So hello to everyone in Florida. And ran into some great people, babies in Atlanta on our travels and also in Syracuse. And boy, it was just really a great time to rest and relax, rejuvenate. I do a lot of reading, but I also just did a lot of relaxation and doing nothing. I came in contact with a lot of no-see-ums. They kind of had a little nibble at my body, and so I'm healing from that a little bit. And boy, it was amazing to see the red tide down in Florida, and what devastation a simple algae and the toxins that come from that, how it can devastate things, and got me to thinking a little bit about how our environment, both mental and also on the food side, can affect our inner environment, our eggs, our sperm, our embryos, et cetera, et cetera, et cetera. So just going to share some thoughts and ideas, take questions. Don't forget to share your likes, comments, really helpful. Jasmine, Carissa, Nicole, Kayla, Candace, Oklahoma, South Carolina, Stacy, how you doing? Rachel, Joe, hello. And again, we're grateful. Remember, if you're on the infertility, if you're suffering or experiencing infertility, we're going to talk a lot about how to make it more of a fertile journey. But if you know anyone else that's suffering from all these autoimmune and diseases like diabetes, hypertension, cancer, etc., keto, and all the things we talk about are really powerful. So it's a lot of sharing with them also. Mechanicar, how you doing? And Sarah, hello, hello, hello. Let's see. First question. Let's see. Amber DQ, how you doing? Is keto recommended for men too? Keto is king for everyone. And don't forget Maria Emmerich. She's got some really great recipes, some great ideas, sharing some great stuff. But keto is for men and women at all ages. I believe that it's a sperm abnormality and an egg abnormality, and thus an embryo abnormality, and also the environment of where that embryo has to implant. But if the intra-abdominal space for the men is also inflamed, that's going to damage the prostate, the testicles, the seminal vesicles. The maturation of sperm requires a really pristine, crisp environment. And there's so much inflammation due to eating too much carbs, not enough fresh, fatty meats, I believe, although as a vegan and vegetarian, there are some plans out there by increasing fat, coconut oil, and also looking at eggs and butter and cream really can help. So keto is king for men and women, for all of us, but keto is simply a label a lot of what we're trying to share is an anti-inflammatory diet. That's the key. And I just got through reading Gary Taub's Good Calories, Bad Calories again. Highly recommended. He's amazing. Great ideas that you'll get some information that I didn't even believe. And as a Western trained physician with very little nutritional instruction, and I believe most of it is really what we're being taught is wrong. Let's see here. Adriana from California, always a pleasure. We're so grateful for everyone's comments, thoughts, and ideas. And remember, I'm learning from so many docs out there, and we're here to share the ideas and concepts of how to make your body healthier in order for reproduction, fertility to happen naturally. And if not naturally, with whatever assisted means you're using, we believe we can improve that. So really, really a pleasure to everyone. Hysteroscopy, Andrea, hysteroscopy showed good results 2 weeks ago and getting ready for the transfer in a few weeks. And so hysteroscopy and scratch, by the way. So by looking into the uterine cavity with a hysteroscope and or simply doing a light cleaning out, a D&C, dilation and curettage, or an endometrial biopsy, we believe we can help improve the stickiness of the endometrial environment and increase pregnancy rates. And there's some controversy in the studies and what it means or doesn't mean, but we all have heard the stories of someone had a miscarriage, a D&C, and then they conceived. And we're seeing the same type of benefits after a hysterosalpingogram, and it maybe even after a course of antibiotics. We think they all are valuable. And I was recently talking to my a colleague, Dr. Fayez Faruqi, who is working in our Montreal location. So Dr. Faruqi's been working with us for a number of years, and we're seeing patients from Toronto and Montreal, but also found out at a recent meeting down in San Diego that even the endometrial scratch, within the first 7 days after your menstrual cycle, you may still gain the benefits of implantation enhancement. So getting ready to go and really great. And hello, Terry and Jamie. It's a CNY fertility community that we're developing, and it's not patients just coming to us, but everyone out there. We believe we have something to share that is valuable for everyone. So if you have a friend, a relative that's experiencing fertility and going someplace else, share with them the CNY Fertility 8 p.m. Sundays Fertile Fireside Chat. They may learn something that's going to be valuable for themselves wherever they're going. And remember, it's what you put in the mind, and that's faith and vision boarding, and what you put in the mouth is really important. Vanessa, does ureaplasm cause infertility? Boy, all these bugs, viruses, bacteria, yeast, and more affect our fertility. It's likely that all of these are at a very low level in our bodies anyway. But when the inflammatory environment changes, allows these bugs to kind of increase in numbers, it can cause some damage to the uterus, the ovaries, the tubes, the testicles, the seminal vesicles, and all of them. So treating with doxycycline may be very valuable. We're also looking at a 2 to 4 week course of antibiotics for men and women, more of an empiric blanket approach that may be very helpful. So I think that is something very important. And hey, Jamie Lopez Moon, how you doing? And Kayla, again, many people are just watching because they have interest in anti-inflammation, health and wellness. And so we're really, really grateful for everyone that's sharing. Let's see here. Lauren Marie, do women with PCOS have more immature eggs? Well, so polycystic ovarian syndrome, also known as metabolic syndrome, which may be related to insulin resistance, they have a lot of resting follicles that when you stimulate their ovaries, you may have a lot of immature eggs that come out of that. But there are different protocols that you can use that may be able to better stimulate a few of those eggs, and either a letrozole or Clomid cycle, we're using a lot more letrozole, with the combination of metformin and also ovasitol or inositol may help some of those eggs mature a little bit better. But you got to be careful, because some of these stimulations where we use gonadotropins may stimulate too many eggs, and now you're only going to be able to use Lupron for trigger and ovulation, which may be good enough to get enough mature eggs, but you may need a little bit of HCG, which is going to increase the risk of ovarian hyperstimulation. So I think that's really an important component to that. Lily McCutcheon asked a question about the endometrial receptivity assay. So we have been looking at the ERA test for some time, and it probably benefits about 30% of patients undergoing mostly frozen embryo transfers. But it may be interesting to find out that many women have abnormal or out of sync endometrium to the ovulatory phase of their cycle, which may be related to a luteal phase defect, which I believe is more related to inflammation again. So the problem in New York is that technically we can't run the test or order the test in New York, but we're hoping it's going to come soon. iGenomics offers that test, and we think there may be some benefits to failed frozens, but my sense is that there may be valuable to learn a little bit more about what's going on in the endometrium. Is there an out of sync between the embryo and the lining, so that when that embryo meets the lining, there isn't enough or there's too much progesterone effects on the uterine lining. So I think that is very important. So we are working with out-of-state centers to be able to do that, and working with Dr. Verdalis in Atlanta's coming. We'll be able to run that through one of our centers. And let's see, Melissa, what have you seen with 300 menopause and 150 going left cycles? Will you get less eggs, but hopefully better quality? There's been more and more information about getting better quality eggs and embryos with a higher menopause or a higher LH levels. And so we've been working more and more to either go monomenopause or at least a 1-to-1 gonal to menopause, follistim to menopause. We recently met with Dr. Fadi Sharara from the DC area, and he gave us a nice lecture to our Albany team on the beneficial effects of menopause. And the LH seems to come from HCG, so one of the reasons we use a lot more gonal to HCG low dose is because it's a lower cost. But obviously you're putting a lot of money, time, and energy and emotions in this. We want the best success. So it may be cutting hairs in some people, but there may be a little bit of a benefit to a little bit more menopause. So we're working on getting a better handle on that. If one protocol isn't working for you, look at another. Brett from Kentucky, how you doing? Let's see. Maggie, a miracle starts kindergarten tomorrow. We were down in Atlanta, ran into some clients. Babies are growing, and just the shout outs of so much success out there. And so when you begin to vision, see the dream that you desire and hold on to that, that's called faith. And we need to hold on to that and draw from that faith and that spiritual energy that's within all of us. It's really powerful. Vision boarding, put a picture of yourself, your partner, family, babies, whatever you dream and desire, and hold on to it. Don't let it go. I know that's so much power that's pulling us and stretching us and making us feel like it'll never, ever happen. But the tough part is not to lose faith, but to keep searching for it, keep reading it, keep imagining it. And that's where I think more and more things are going to come. Jessica MB, how you doing? Let's see. You mentioned there's no such thing as unexplained infertility. For someone that is 32 and having secondary infertility plus DOR and removed endometriosis, what else can be checked? Well, so unexplained idiopathic infertility is inflammation. It's all inflammation. And remember, the majority of harm to our body is what we put into our mouth, because we're consuming a tremendous amount of carbohydrates, fruits, and fiber that ultimately causes the inflammation in our gut that leads to endometriosis, that leads to diminished ovarian function. So you may have diminished egg numbers or egg function. That's where the DOR comes in. And so you could look at AMH to give you a number, but I think really you don't need to look any further. It's inflammation. It's what you consume in your mouth. That's number one. And by shifting to a mostly ketogenic diet, again, look at Maria Emmerich, Dr. Eads, Ellen Davis. Really, there are so many resources out there. And we've been touching on low-dose naltrexone. And I've been talking about CBD oil with 0 THC. And we're really, really excited about that. Do your own research and reading. Look at CB Distillery, HempWorks, and also Charlotte's Web we've been looking at. I don't know the right place to buy it. I don't have enough knowledge of it, but from what I'm reading, it's an omega-3 fatty acid that we know through adding fat reduces inflammation in the body. And that's why we use so much intralipids. And that's why we're really focused on the immune protocol with Lovenox, prednisone, Prograf, Humira, in some cases, IVIG, and LIT. So doing the laparoscopy, removing the endo. Some people recommend a 1 to 3 month course of Depo-Lupron, which further shuts down the estrogen. And for some reason, the combination of inflammation and estrogen seems to feed the pelvic inflammatory process and feed the inflammation that causes scar tissue and ultimately endometriosis and infertility. Shauna from Ohio and Krista Tate says she uses the HempWorks. And really, as we all talk more and more about it, when I was getting all these interesting bites by these no-see-ums and added the Charlotte's Web lotion, the hemp lotion, it really helped tremendous. And again, it's all about inflammation. Number one, it's inflammation always. And let's see, Caitlin Lindborn, how long after lap and HIST do you have to wait to start another cycle? I usually say you go right into it, because whatever you're doing on that laparoscopy, hysteroscopy. So remember, the laparoscopy is the looking through the belly button to look into the pelvic cavity, to look directly at the uterus, the ovaries, the tubes, to look for that endometriosis and that inflammation. And remember, sometimes our eyes aren't quite good enough. So if it looks pristine normal, it doesn't eliminate inflammation, but at least tells us that there's no significant scar tissue or endometrial implants that we can remove at that very moment. So I would say I've had times where I've done a laparoscopy at retrieval, although I don't recommend it and we don't do it that often, where we removed a tube and went right into a transfer and got success. So it can be done pretty quickly after that. Christina Copley, how you doing? How long do you recommend being on metformin for PCOS patients before starting stims? 4 to 8 weeks should be long enough. I think the 2 to 4 weeks of keto is really powerful. It really is what you're changing in your intra-abdominal environment, what's in the gastrointestinal tract. It's so critical to get it out of there. And that's why I recommend sort of the cleanse. And Maria has a keto cleanse book. Take a look at that. And her husband, Craig, by the way, has been contributing and really excited about all the things that we're bringing to the health and wellness. Allison, how you doing? Allison, Stephanie, Liz, and Kim, part of our donor team, are remarkable. I'm very proud of them. And I know that there's so many people coming our way. We really just ask for a little bit of patience in the process. I know it can make us all pull our hair out. Communication, it can be challenging, and I know it. And we're really working to just pass it on, get it to you in so many ways. As they say, good things come to those who wait, and just be patient with us. We're really trying to get you the very best care, the very best pricing, and high quality. And the successes are out there. So please share the successes. That really is helpful. When people see and hear about success, they can then visualize it for themselves. Terry, how are you doing? Let's see. Greatest treasure is really family. And I know when this is not happening naturally, how stressful and terrible it can be. And when then we're adding all the things that we think should work and it's not, boy, we want to pull our hair out even more and more. Let's see. Jessica Repanajan. I apologize if I pronounce anything wrong. Would you still recommend HSG SHS for someone who has had their fallopian tubes removed? Well, the HSG at least the sonohistogram can be important in looking at the cavity. If you've had the tubes removed, the HSG is not so necessary. I do recommend hysteroscopy also, because sometimes that there are some minute small areas that you can't see and with the sonohistogram, so it really is important to take a look inside there. Hey Jan Wainwright, how you doing? Bianca, Melissa, CBD BioCare. And again, if you know anyone with a success story from CBD oil, please share it, because we have a lot that have used LDN, and Phil Boyle from Ireland's been using LDN for a long time. Let's see, Wanda Cordero, they just removed my one ovary, one tube that makes a good cannabinoid candidate for tubal reversal. As long as you have a good tube and ovary, and depending on what they remove that tube and ovary for, it certainly may still be possible to do a reversal. And we do them, 7,900, which also includes an IVF procedure. So we do those laparoscopically in our Syracuse office. And Terry Shea Duani, sixth cycle, the baby diet, bacon, eggs, butter, beef, and was successful. So thank you for the story. Again, keep them coming and sharing them. And just because we're here on our Sunday, 8 p.m., people are sharing this, and share the link to the Fertile Fireside Chat on a regular basis. Kansas City, Rachel Beeley, Rachel McMillan, and Harmony, always best. I had a great time away. Thank you. Let's see, Danielle Zastko. Hello to you, a pleasure. Question, if a man has a morphology problem and motility, would you recommend IVF better than artificial insemination? IVF offers the highest success for male factor over IUI and intercourse. But remember, do not give up. LDN, keto, maybe CBD helps the sperm, the egg, the embryo, the environment for both of you. So in the meantime, where you're waiting to do your IVF or do your IUI, or for it to happen naturally, imagine we're taking care of the most valuable, expensive, irreplaceable entities of the universe, the human Ferrari. We are that. We must take care of ourselves better than you've ever imagined. Our things, our homes, our cars, our favorite this and that, boy, don't we take care of them, but we forget about ourselves. Remember, alcohol is toxic to eggs and sperm and embryos and babies. Don't touch it in this process at all. And remember, carbs are killers. And I know it's kind of crazy, but I've just learned so many crazy things on this crazy journey that I've learned. I wouldn't have believed it 10, 15 years ago. But the more I eat like a lioness. That is it, like a lion. I call it the lioness plan. And as we each, why some people have 10 babies and they look like they're so unhealthy. Remember, our ability to look and understand health and wellness is really, really bad. Don't try it, all right? Even as a Western trained expert at this stuff, how little we know. And we're constantly reading articles thinking that somehow we're going to learn the right thing, and we're not masters as this as much as we'd love to believe it. Jessica, let's see, asked another question about ICSI, or traditional fertilization when eggs and sperm are placed into a dish. Our 99% is ICSI, or intracytoplasmic sperm injection, where we inject a single sperm to an egg. You're getting to this point, you want to use every little bit of the puzzle that's going to increase your chance of success. That said, you don't have to do that, but it's our standard. If you want to do something different, we can help you change it up. And I'm noticing that people are asking questions of other participants and getting great answers. So that's one of the beauties of this CNY Fertility Village. We're all sharing immensely. And don't forget Erin McCullough, Fertile Hope Yoga, and she's coming out with some really great stuff about the mind and meditation. And our website, Will and my teams through Mooney Marketing and and DigiHive, Jeff Noss, and so many other people on my team are helping our new website and really trying to make it interactive. And so if you're finding areas of, hey, we made a mistake, ship it our way, or what we can do better, always share with us. And I'm always learning how to do things better. And let's see, Illinois, we're seeing patients, Massachusetts, Illinois, Connecticut, North Carolina, Tennessee, Kentucky, California, Washington State, Oregon, the entire country. One is leading affordable center in America, and people travel around the world for their fertility or other health and wellness issues. And so we believe that traveling to Syracuse or Albany is really closer than you imagine. We're working on the combined $4,500 for the IVF and the monitoring if you come to one of our locations for those. So just ask about that plan. And if you fail after 3, the 4th is $600 in our self-pay product. So, again, ask, and we're always here to help. And Elizabeth Myers-Ott, what do you suggest for someone who is lactose and gluten-free to eat to help with IVF? And I'm a vegetarian as well. Well, eggs and butter, but you want to get grass-fed. That may be the key here. The coconut oil, and I've also been looking at that hemp seed oil is high in omega-3s and has all the proteins, essential amino acids, and essential fatty acids. May be very interesting to try and add to it. And also one of the things I've recommended is take your carbohydrates, simplify them, really cook them down and add cream and butter. But if you're sensitive to lactose, it may be mostly milk and yogurt and the non-fat. You might want to try a really high organic grass-fed cream, but if not, butter, and if not, that's where you're going to add the coconut oil or the hemp seed oil. I think that could be real helpful for you. Let's see. Amanda Lindsay, how you doing? So functional medicine doctors. So listen, this is an integrative world of health and wellness. And I'm reading a great book on American Indian herbal medicine and healthcare between the mind, the body, and functional medical doctors are integrating all these things. So as an Eastern trained, but Western and Eastern integrated, we really need to be incorporating acupuncture, chiropractic, functional medicine, homeopathy, music therapy, scent and oil therapy, and you'll find in light therapy, there's so many things, and massage and touch. We're forgetting about how important all this is to reducing inflammation, reducing cortisol, reducing epinephrine levels in our body. They're really powerful. So there are a tremendous amount of vendors out there, and Amanda suggested Bluebird. Again, we're looking, I think our next step is come with an article. We'll put it out there, some of those that we've rated and that we think are valuable, both in price and quality. So we want to be sharing all of this with everyone because, again, it's not just Eastern, it's not just Western. We believe it's a combination. And you're on your journey at the place you're at today. You may have been in the Western, you're now on the Eastern, or been in the Eastern, you're now on the Western, or you're beginning to integrate a combination on both sides of that. So, Penny Fantagrossi, how you doing? Bone broth, yes. And remember, it has a tremendous amount of minerals and vitamins and the fat that's really necessary. And the interesting part to our bodies is we are fat burning, by the way. We are never glucose, carbs, and then fat. We're always fat burning. And so the keto flu, when you're going through that first week, 2, 3, or 4 for someone, remember, we're addicted to carbs. We want them bad. They make us feel good. And remember, we are built to pretty much eat everything and anything because our environment had a tremendous amount of carbs, and we learned through agriculture how to make them available. But what I'm finding is that we don't need any carbohydrates in our mouths ever. Check out my ice cream recipe, Dr. Rob Kiltz ice cream recipe on YouTube, and also steak. But listen, we're all venturing a little bit here and there. We're learning for ourselves. That's why it's important for you to read. And it's pretty amazing in the process. April Smith Foster, how you doing? It is 0. Let's see, 2, again, some people, depending on your professions, can't use CBD oil at all. THC free, it doesn't matter. But so be careful. You got to check into your what your guidelines are in your profession, whether you can touch any of this stuff. Christina Copley, Centralized to help. So, like you guys are answering them before I even get a chance to get them. So rock on to all. So the Cetrotide or Ganirelix is used to prevent premature ovulation. It can also be used to shut down the estrogen, progesterone in the luteal phase to get you ready for a stimulation, or if there's a cyst that's in our way and that we want to suppress it, that's another way to do it. Lupron can be used, but it has a stimulatory effect first, where you might see the estrogen go up and then go down, and you need to take it a little bit longer. Let's see. All right. So Rachel Hayland, HCG to boost count. All right. I'm betting there's a question in there that I may have missed, but HCG boost for guys. So daily HCG at 250 units to boost count. But the HCG for ovulation may help in the quality of the eggs and thus the embryos. Rachel, price include meds. Okay, so the price of our IVF does not include medications or monitoring. So the $3,900 is for the actual retrieval, the laboratory, and a fresh transfer and freezing of the embryos. It's $250 for the transfer of those embryos, not including the monitoring or the meds, until you have a baby or after 1 year. We're about $800 for the monitoring, but if you combine them, we're doing it for $4,500 for the self-pay, and you can put all that on financing. Now, medications can run from a natural cycle where you need none to a mini cycle, which is letrozole or Clomid, with or without a little bit of FSH going left, Menopur, which is at about 150 units to 300. Actually, more like the 150 units. So you can save money by doing a mini. And typically, if you're getting a few eggs and a few embryos and you're doing a fresh transfer, boy, you can save a lot in doing that. But our standard is usually about 300 units. So you're looking at about $2,000 to $2,500 through Integrity. But we're working with some others that are looking to make it more affordable. And people are working on ways to getting medications in lots of different ways. Let's see. Lauren Chun, talk about how to reduce subchorionic hemorrhage. So once you're pregnant, that embryo implants in the lining. The embryo could separate from the lining and a blood clot can develop between the implanting embryo, fetus, sac, and the uterine lining. And so it's likely due to inflammation, high inflammatory environment, diet, stress, but there's so many causes we think, and I think there's 5 causes: glucose, plant antigens, phytochemicals, fermentation, and then exercise. But one of the ways is we're looking at use of Lovenox, aspirin, steroids, maybe even IVIG or intralipids to reduce inflammation, to reduce the subchorionic hemorrhages. Rest, and potentially antibiotics that if there's an inflammatory reaction through to bacteria, in the vagina, bladder, urinary tract infection, so it may be real important to get those treated early and fast. The majority of these, thankfully, with rest, resolve on their own and don't go on to a miscarriage, but they may be a precursor for that. Again, we believe that the inflammation in the placental bed causes that separation, the blood clot, and the subcranial hemorrhage and potential miscarriage, which is obviously hard in all this. BU from Austin, Texas. Maplewood, extended stay in the Q's. Egg retrieval, we're looking forward to helping and taking care of you. Transfer fresh. I always say prepare for a fresh, but always be aware that it might convert to a frozen. If your progesterone on the day of trigger is greater than 1.5 to 2, and there's a little bit of a range there, or you have a significant number of eggs or estrogen level, greater than 3,000 estradiol level, we tend to recommend the frozen cycle. There's some evidence that doing a freeze-all and a frozen cycle is a little better success, but it's not straightforward. And so we always want to be ready to be one or the other. And in general, day 3 or day 5. Well, day 3 is the cleavage stage embryo. So day 0 is the day of retrieval. Day 1 is the next day with fertilization check. You get a call. I've got X number of eggs that were injected. How many fertilized? And if it's 4 or fewer, we generally recommend a cleavage stage day 3. If it's 5 or more, we generally recommend a blastocyst stage, which is either day 5, day 6, or day 7. If you failed with any of those in the past, we're always looking to do something different. We've seen so many that have had failed blasts. They just don't make blasts. Or they failed to get to a freeze-all or a transfer. We recommend doing a day 3, and we've seen a lot of benefit to that. And some centers will say, well, this is the only way we do it is a blastocyst. You're eliminating some people that had they done a day 3, they may have conceived and delivered a baby. Because our culture environments aren't perfect. You know, if it's not going to make it in the human body, in your body, that's where a gestational carrier may come in. But if everything looks right and we're working on reducing inflammation in your body, we want to do everything we can to maximize the odds. And one of the important things to this whole process is that what you're doing isn't working. Keep at it, positive and persistent. And I know this is really, really hard stuff that emotionally, physically, financially, we just don't know how we can do it anymore. I don't know how anyone does this because it is hard, hard, hard on everyone. And so keep at it. Brittany Hope, what kind of tests or recommendations do you have for 4 failed transfers? One embryo left. Hysteroscopy, laparoscopy. Look for endometriosis, endometritis, a 2 to 4 week course of antibiotics. Look at immune markers and/or look towards the guy and check for morphology issues, DNA fragmentation. Look for a varicocele. All right. Again, there may be a sperm issue that we missed that makes an abnormal embryo. And I always say keto is king. You got to really do the work. LIT therapy, leukocyte immunotransfusion, where the male's white blood cells are injected under the female skin. It's the male allergy test or treatment, and it seems to work. Add embryo glue, acupuncture, massage, all of those things. And don't give up. Neupogen and HCG wash and Neupogen sub-Q. So these are the immune protocols that I think can be very, very, very helpful. Let's see. Samantha Jo Maurice, castor oil packs, warm baths, encourage blood flow to the female reproductive system. So as I'm reading this book on ancient American natives, where they utilized a warm, the warm hut, the steam hut, and then after heating their bodies up, and with these herbs and steams and packs, they then immerse themselves in a cold plunge. So my bet is it's a combination of increasing the blood flow and then reducing the temperature quickly to really reduce the inflammation. I think it is really important. These are some of the things that we don't talk about too much. Athena Euclides, benefits of CBD. There's a great article, and you can just Google on CBD oil and inflammation, and it's more of a general article on CBD oil. And my bet is it's a combination of the phytochemicals in the hemp oil, and it's the oil itself, the fat, the omega-3s, omega-6s, that really are important to reduce inflammation in our bodies. And some people will recommend it as drops, 500 milligram bottles, 30 mLs, 2 to 4 drops twice a day, or tablets, or I should say the liquid tablets, or a patch, or a cream, or a balm. All of these can be very helpful. In some way, we're still learning, so your input is really, really helpful out there. Day 5 report, Nicole, tomorrow. We're hoping it's all going to be great. And we've seen so many that have failed and failed and failed and failed, but didn't give up, fostered a new faith and changed the food and success. And sometimes it's just they gave up, and I should say gave it up and let go. And I know, you hear the words, oh, just let go, it'll be fine. And that's not easy to hear, I know it. And I'm practicing every day to slow it down. I need to do a monthly 4-day respite is really helpful, but I'm always reading and listening and learning about ways to help on the journey. Thanks, Christine, about HGH or Omnitrope for improving egg quality. And even maybe sperm quality, human growth hormone, 30, 60, 90 days plus keto can be very helpful. Also, don't forget low-dose naltrexone, LDN, and CBD. All of these are really helpful. Yoga, meditation, walking, and stop running. Walk in nature, listen to something good. A good book can be very helpful. And positive. That is really so important. But the Omnitrope, we think, even if it's just in stem, along with the Menopure or low-dose HCG, is going to help tremendously. But we've also added Neupogen to a stem protocol that may also help in that. So thank you, Christine, for bringing that up to my conversation. And let's see. Oh, Chelsea Morose, do we have experience with reproductive immunology? Well, we are a center for reproductive immunology, and really it's the foundation of what we do is reproductive immunology. And since the immune system, it trumps everything in this conversation. Prednisone, Lovenox, intralipidids, Prograf, Humira, Plaquenil, IVIG. We think IVIG is really the gold standard, but it's more costly. This is why CBD, LDN, and keto is really something you have access to very simply and slowing it down. But everything we're doing is about the immune system, nothing else. We have learned from Dr. Braverman, Dr. Beer, Dr. Kwok Kim. We're all working together here and sharing ideas. And we're glad to work with everyone and improve your chances of success. And the hope is that it happens naturally. So don't give up. 44-year-old, no eggs, 2 IVFs, keto, pregnant spontaneously. And we've seen so many that after laparoscopy, hysteroscopy, scratch, keto, yoga, acupuncture, it's just amazing. And Don Clark, amazing acupuncturist with us, Heather Smith. We just have a great team at all our locations. And if I'm not mentioning everyone, please forgive me. It really, really, really takes you tremendous. And we've worked with Dr. Braverman, and an excellent, excellent clinician, has great ideas. Recurrent loss, my last was chromosomally normal. Very, again, we do all the things that Dr. Braverman does. We're all learning from the same pot of information. So we're glad to help along with Dr. Braverman, whatever we can do out there. We're here on this. Hey, Rachel Long, how you doing? Negative side effects from long-term use of Omnitrope. Well, read the label. Everything is risk. Driving a car also. You know, in general, we're recommending 1 to 3 months at best. If it's not helping, maybe it's not going to. We're not recommending long-term use. Recent meeting, Marnie and Bridget went to the San Diego meeting. They talked a lot about Omnitrope, used mostly in STEM to improve egg and embryo quality. Caitlin Lindborn, what should your progesterone be 1 week blood work after IUI in order to be able to hold a 600? Well, 10 or greater is really what we're looking for on all scales. IVF, quite commonly looking for 15 to 20. So there's a little bit of a range, and we can always add either progesterone in oil, oral prometrium, or vaginal prometrium inserts, crenone, or endometrium. So they're all available out there. 3 remaining embryos, and from Christy from San Francisco, welcome. PGS normal embryos. We're here to help, and again, keto, slow it down, de-stress. Remember, the supplements are real important through Theralogics. Ovasitol, which is inositol, reduces glucose and insulin levels, reduces inflammation, and that's why keto. Paleo, by the way, can be very helpful. So I don't want to forget the approach that whether the label is a vegan, vegetarian, standard, Mediterranean, paleo, keto, we really want to be focusing on an anti-inflammation dietary plan in all this. So, and really, Athena, thank you for your shout out on blessings to everyone. We are a village, all of us, in this fertility world of helping. And whether it's CMY Fertility or any other fertility practitioners, and whether you're a non-Western trained or a Eastern trained, whatever your training is, we're hoping that we're all bringing to the table something to help our clients on this challenging journey. Jennifer Shore, how you doing? What are your thoughts on prednisone? I believe it helped me say I have success at CMY. A friend with unexplained infertility, third failed transfer, won't try prednisone. Well, you know, we used to use a lot of dexamethasone. We've switched over to prednisone. I think it's a little more powerful in the 5 milligrams to 10 milligrams twice a day. And we're actually using a lot for intercourse, IUI, IVF cycles, all combined. And we're finding that we're getting a little better success. But again, if what you're doing isn't working and we try something else and it gets success, we all think that that was the thing. It may have been just that next embryo was it. We all want to know we're in the process of doing and trying something else. And let's see, Paul Pippin, how you doing? You know, this journey to conceive and be a parent, it's a challenging one, and no one wishes this on anyone, but I have to imagine for each of us, whatever comes is part of the gift to help us grow and learn and create even better. Let's see, nursing school, metformin, have been on this for 8 years and have just recently been diagnosed PCOS. Well, you know, metformin and all these medicines don't necessarily prevent PCOS. I believe metabolic syndrome and PCOS is still all due to a standard American diet it's eating carbs too frequent, too much, and not enough fat in our diet. And when I say fat, animal fat, that's really who we are. But if you can't take it, look towards butter and eggs and cream. Those are all things that can be very, very, very helpful. Marissa Will Goringer, how you doing? Low vitamin D. Recommend getting a prescription to help increase. I was taking over the counter 2,000. You need to go to 4,000 to 6,000 a day. There's 50,000 a week you can take. It's not necessarily a prescription, but again, if you're eating a lot of grains and inflammatory products, no matter what you put in your mouth, it can be depleted from the gut because it's just washing things out. So it really has to, again, look at Maria's keto book. It talks a lot about the inflammation in your body and how reducing it can help replace and replenish your vitamin levels. All your vitamins and minerals are depleted in the standard American diet and lifestyle we all have. If you're eating packaged food, it's not good. And if it claims it's got a yellow label and it's healthy for you, my bet it's not. You should be eating fresh meats if you can with the fat, because it's the fat that is where the majority of the minerals and vitamins that you and I need are at. And I know I'm sounding completely opposite and crazy from so much we've learned, but from Jimmy Moore, Jason Fung, so many were learning this, that we can change our health and wellness. And now for me at 62, 0 exercise and nearly 0 carbs. It's just made my life amazing. Hey, Kim G, how you doing? Our travel team, global, is amazing. Kim, Donna, Trish, Justine, just everyone out there. Greta, I'm grateful. And these ladies are amazing. They're getting so many calls, it gets a little overwhelming. They're really, really, really doing their best. And we appreciate everything and anything you're doing to share the words of how people can improve their chances. And giving advice is really, really helpful. Let's see. Can you tell me to do following an FET, meds or anything? Athena, how you doing? So, we're doing a lot more natural FETs with the trigger and or letrozole trigger and minimizing a lot of what we've been doing. And don't forget the hysteroscopy scratch ahead of time, which may help with that. And then look at the immune protocols. If so much of what you've done hasn't worked, it's an immune problem that we're just not getting to the foundation that's going on there. Let's see, Erica Pittman, taking DHEA for the first month. So DOR, DHEA, 25 milligrams 3 times a day can help improve ovarian function. Uterus cramping, this cramping in the luteal phase, all this cramping, again, it's inflammation. Adenomyosis, endometriosis, and why at certain times of the cycle, I don't know how the DHEA is really affecting that, but since it adds to the precursors of your hormones, it may be increasing the hormonal output in your body that's affecting the estrogen, progesterone receptors, and all those are linked and related to blood flow, to mitochondria, and the mitochondria are critical in our cells, and so much our damage to our fertility is related to mitochondrial damage and disease. And recently reading an article that talks about increased mitochondrial DNA actually may be a signal of poor implantation, and my bet is inflammation damages mitochondria, which causes the mitochondrial DNA to say, hey, we need some new mitochondria. In the process, it's telling us it's an inflamed and damaged environment. Highland, Indiana, how you doing, Highland? Again, it's really spectacular that everyone's sharing their words. And Katie Haman's Nosworthy. How long do you need to stay in New York for retrieval and fresh transfer? So typically you're going to get here the day before the retrieval. Retrieval next day, and day 3 transfer is about 5 to 6 days. And typically you can leave on day 3 transfer. But if you're going to the blast transfer, you're going to be here about a week, and you can leave at that last day. CNY Healing Arts. So CNY Fertility and Healing Arts. So our spa is where we do our acupuncture, massage, and other light treatments and things to help slow down. And you can tell from my energy from time to time, it's high. And I started a website about 12, 15 years ago, Mind, Body, Smile, to help me slow down. So I start the day every day. Thank you, God, for the day. Thank you, nature. Thank you, Creative One, for this beautiful, awesome, amazing day and how grateful I am. And I'm grateful for you, by the way. All of us together sharing this journey on how to improve our outcomes. And you know, sometimes what we do isn't working and it gets very frustrating and we get lost in the process. And we all need to step back, reappraise where we're going, what we're doing, and what we're thinking. I always imagined whatever happens to me was the gift to slow me down. Hey, Nicole Dixon, how you doing? Let's see. How do you gradually, if you have to gradually decrease, I decrease for 1 week, then went hardcore keto on week 2, and again, minimal sugar withdrawals. Good. So, you know, the one way is to go cold turkey when you go to stop cocaine. The other is to gradually. I like to separate out them in a time frame, breakfast and dinner. Now, I do dinner alone. I've really reduced a significant amount of the food that I put into the Ferrari. Remember, we're Ferraris, and it really helps tremendously. Wow, it's pretty amazing. It's almost an hour that we've been conversing. Jan Baker, how to improve egg quality. So egg and sperm. Remember, keto, keto, keto. Slow it down. Yoga, acupuncture, massage, meditation, helpful. And then the DHEA, CoQ10, fish oil, folic acid, vitamin D, critical. I've looked at PQQ and CBD and LDN. All of those will help. And then don't forget human growth hormone or omnitrope for 2 to 4 weeks can really help on that. So I think it's really good. And as we talk about it, touch with spa employees to see where they can take their fertility specialty classes. After being this journey myself, I want to take fertility massage class, specialize in my massage. Well, Mayan massage is really helpful. My bet is that our health and wellness techniques into whichever thing we're working on, but remember the core, the lower abdomen and pelvis is where it's all happening. And that's why the gastrointestinal tract is so critical that we work on in this. And oh my gosh, Amber DQ, sorry about your loss. PGS, CCS, the muscle before transfer. So PGS or pre-implantation genetic testing for aneuploidy, PGTA or CCS, all of these can be done ahead of time. It may help and reduce slightly the risk of a trisomy. I personally think it's anti-inflammation. That's the key. But if you did untested embryos, tested embryos might help your odds a little bit. That's a little controversial right now, and some people are beginning to think that it's not necessarily the end-all, be-all, and the home run. But all these things are important. So let's see here. Wheatgrass. It may be that wheatgrass contains a phytochemical that may be helpful for egg quality. But that said I'm always concerned about the other phytochemicals and or the carbs. But wheatgrass is a small shot that there may be some value as an anti-inflammatory. It's not a seed. I think the seeds and the blossoms of most of those plants are probably not good. Morgan, baby aspirin before FET. Well, I was just reading a really interesting article about aspirin. It may be higher doses than the 150 milligrams, maybe, or the greater than 100 may be more helpful. But the literature really isn't straightforward on this, that we can answer it perfectly. We're working on it. But one article I read that increasing the dose to 100 milligrams or greater may be a little bit more benefit there. And let's see, one more question. And again, thank you to all for sharing on this beautiful journey. So Nicole Ford, can you only transfer one PGS normal? So one and done for PGS tested embryos, one. In the rare cases, multiple failed, we may consider two. Interesting enough, what's the cause of a PGS normal embryo from failing to implant? Inflammation. Remember, inflammation is the number one. So let's see here. Kim McCurry, 7 weeks still taking THC free. I think that CBD and LDN and keto is key for life. Everyone, really a pleasure. So grateful. We'll see you next Sunday. Send us your questions, comments, ideas. Thanks for being so patient. This is Dr. Rob Kiltz, See My Fertility, Fertile Fireside Chat. Have a good day. Bye-bye.